What I'd like to move on to now is some of the questions we've got through Facebook. So first of all, I have Jeanette from Michigan. She has been asking, what do you feel is the biggest unnecessary birth intervention women face, and what do you feel can or should be done to change it?
I think there's a couple of things, and what I just talked about before is that the core requirements for the labouring female of any mammalian species, including women, is that we feel private, safe and unobserved in labour. So you could say the first intervention is providing an environment where women don't feel private, safe and unobserved, and all the rest of the interventions often follow that. So when we don't feel private and safe, then our fight or flight hormones, adrenaline and noradrenaline kick in, and they slow our labour down. They can actually deprive our baby of blood and oxygen, and our labour gets slowed, so we need, synthetic oxytocin, pitocin, syntocinon to speed it up, and then it's too fast and the baby's suffering and we need an emergency cesarean, or we need a vacuum or a forceps, and then we have a postpartum hemorrhage because of those drugs in labour. So the first intervention really is that we don't provide physiologic conditions for labouring women, and I really recommend that women take that seriously and organise that for themselves, get themselves a scenario for birthing, an environment where they feel private and safe and as unobserved as possible. So home birth is an ideal. If you don't want to have your baby at home, that's totally fine, but you need to have someone in hospital that's going to protect your space. The other thing that I'm concerned about, which is really worth considering when you're pregnant, especially first-time mothers, is induction of labour. And that's an intervention that tends to have that what we call cascade of intervention effect. So if you're induced, your contractions are more painful and you'll need some form of pain relief. And the pain relief, it's an epidural or an opiate drug can slow labour down. And, things flow on and then you can't push, and then you need forceps or a vacuum or a cesarean, or your baby goes into distress. So that's a cascade of intervention. And, the initiating factor for many women is induction of labour. So you really need to consider, do you really need to be induced? And a lot of inductions are happening for social reasons. The woman, we say we're sick of being pregnant, we want to get the pregnancy over, but really the end of pregnancy is that time when your baby it's really important to your baby. Your baby's brain is finishing off their development, your baby's getting ready to be born, all the organ systems are maturing so that they can function optimally for life outside the womb. So that's one of the most important times of pregnancy, is those last days and weeks, and I really recommend that women don't bypass those and accept induction for non-medical purposes. And I also have a lot to say about induction for post-dates for going overdue. You can read a lot about it in my book, Gentle Birth, Gentle Mothering. But again, I think the risks of going overdue are way overplayed in most maternity care systems. At the most, the risk for the baby is 1 in 300. So 299 women out of 300 who go a week or so, more than a week overdue, are going to have a good outcome. So, if you're induced, especially first time, your body hasn't been through all labour and birth, and it takes longer to get started. And the other thing is, when you look at the physiologic research, when we look at other animals, and a lot of this research is done on rats, yeah. So rats have on day 22, every rat goes into labour and gives birth. But women are really different to that. There's a wide variety of due dates, you could say, for women. Some women will naturally go into labour at 37 weeks. Some women will naturally go into labour at 42 weeks. So, the estimated date of delivery, the estimated due date, is very approximate for women. And if you induce someone at 39 weeks, they may be 2 or 3 weeks from really being ready. And, from the baby being ready. And it's the baby that signals labour. The baby says, yes, I'm ready to be born. I'll put your body into labour. That's the way it happens. So we're really, doing a disservice to our babies and not letting them get that full readiness and ripeness for life outside the womb when we induce. So in terms of avoiding significant interventions, I think avoiding induction is a really good idea.
But what happens if, say, I'm guessing it's most of the obstetricians saying, well, no, we need to do this. And I hear about a lot of pressure from obstetricians to induce labour. No, we can't. I mean, I've even had the pressure, and it was almost to a point where I thought, I'm just not going to go in. And I know that's not good, because you really should be, working with those, with your caregivers. But I find that there is this white coat mentality. They kind of scare you into things. And how do you question someone that you feel has that authority?
Well, it is tricky. I agree. And again, I'd recommend having your own advocate, having a doula, having someone that you can talk these things through with. Right. And not necessarily that she's going to give you advice, but, you want to have someone to bounce the ideas around and someone who'll support you. And if you want to have a natural birth, and from my point of view, that's by far the best outcome for mothers and babies, then you really need to limit the use of interventions. And you need to question those things, and whether you question them in the room, in the consulting room, where you go away and talk about it with your doula, and you say, I don't want to have that intervention. And it's your body and your baby and your choice in the end, and you're the one that's going to have to live with the consequences of it. If your baby really isn't ready and ends up in NICU and you miss those early days with your baby, these things can happen as a consequence of getting pushed into something. And I know it is. I'm not saying that it's necessarily easy to stand up to that, but this is welcome to parenthood. You're going to be in that situation the rest of your life as a parent. People are going to have ideas about what you should or should not be doing, and it's your job really to stand up for what you know is the right thing for yourself and your baby. And the last thing I want to say about that is, I talk about science and physiology, but I'm a mum as well, and I know that mothers and babies are connected at this very deep level, and I know that you can communicate with your baby. I know that babies send messages to mums, and you can check in with your baby and say, is this the time to be born? I know that communication is happening all the time in a physiologic sense, and I really believe that it's happening on every level between mothers and babies. I mean, imagine being sort of, glued on to another human being for 9 months. You'd get pretty close to each other, and you'd have a whole lot of unspoken communication. So I really believe that it happens with mothers and babies. And what I mean by that is, as a mum, you can really trust your intuition. People tell me a lot of stories about this. I had a story of a mum who was agreed to be induced because the obstetrician was going away on holiday. And she said, when I went into that room, I just had a really bad feeling about it. I thought I shouldn't be here. But he said it was okay, so it was okay. And she had a bad outcome with her baby. And alternatively, there's other people who really need intervention. And I know women who have said, I got this message from my baby really needs help. And I thought that was crazy, so I didn't go and do anything about it. So it can go either way. And I really advise women to listen to your body and listen to your baby. That's one of my big take-home messages is, trust your body, trust your baby, and trust birth.
It's really interesting. And I think women a lot of the time forget that, and they may not be used to hearing that from, a doctor. They're used to hearing that from, people like myself or their midwives or their doulas, So, that's really interesting. Just also, Gracie from Tennessee had asked if you could say something, send a message to obstetricians who, you said before, some may have not even witnessed, a fully natural birth. What would your message be to them then?
The system is designed to work. We've got this whole physiology that's, you could say, package deal. It's designed to work in particular ways. And when we start interfering with it, we don't really know what the ongoing consequences are. And the problem with medicalised childbirth is we haven't really researched it. We don't have a lot of information about what the impact of various interventions are, particularly in the medium to long term. And again, this is a bit of a consequence of our maternity care system of using specialists, because you've got to see your specialist, your obstetrician, and all they see you for is the duration of your pregnancy and perhaps the next one, but maybe not. So they don't ever see what happens down the line with breastfeeding, with your relationship with your child, your health and well-being. They don't see the long-term consequences of what happens around the time of birth. And and we don't have a lot of research on that. We haven't really looked at that. But as a mum, I know that what happens for me around the time of birth, how pleasurable it is, or how difficult it is, or am I traumatized? I can take that into the rest of my life ongoingly. I can certainly take that into my relationship with my child. I know some women have said to me, the day my child was born was one of the worst, most traumatic days of my life. Wow. And that's really difficult to take into your parenting. Yeah, you love your child, but you've got that memory that's associated with them. Whereas Mother Nature's design is that the day your child's born is the best day of your life and their life as well. So, consider the long-term impact of things and really look at the evidence and consider that birth is designed to work in a whole lot of complex, intricately orchestrated ways that we're only really beginning to understand. And one way that I look at it, I think how we thought about breastfeeding 20 or 30 years ago, we thought it didn't really matter, the baby was just as good on the bottle, women's bodies didn't really work that well, they didn't really make enough milk. And it turns out that women's bodies don't make enough milk in breastfeeding because we weren't giving them the right conditions. And from my point of view, it's exactly the same in birth. We're only really beginning to discover the huge benefit and the long-term benefits from natural childbirth, and to really make it to optimise outcomes for mothers and babies, we need to again look at the environment that we're providing for women.
Last Facebook question is Kate from Maroochydore, near you, and that's in Australia for anyone who's not from here. If there's only one piece of advice you could share with pregnant women, what would it be?
My advice is always trust your baby, trust your body, and trust birth.
Great.
We've got millions and millions of years of evolution behind us, and all of our bodies are superbly designed for labour and birth, and we really can trust the process.